Okay. Welcome everyone to the Plains to Peaks Regional Network Learning Opportunity. It's July 25th, 2018. Really excited about today's call, and thanks so much for joining us today. Okay. So we're going to start, as we usually do, with introductions. This month I was curious, as usual, if you could introduce your name and what your role is in your organization. But I was also curious if anybody is presenting at the Safe States annual meeting in September, and if you are, I was thinking maybe a good opportunity would be in August to present to this group, because I know not everybody can attend that conference in person, and I thought it would just be a nice opportunity to practice the presentations, but also to share all the great work that we're doing within our region. So as we go through, if you could let me know and answer those questions, that would be great. I'm going to go down the list that we have, that I have on the participant list, and call out your name, and then if you could introduce yourself, that would be great. So, so I'm Colleen Kapsamalis. I am I work at the Violence and Injury Prevention Mental Health Promotion Branch here at the Colorado State Health Department, and lead the RNCO Plains to Peaks Regional Network for our regions, states in our regions 7 and 8. And I am presenting at Safe States in September, and would present if anybody needs it, but I also just presented the Safe States Innovative Initiative webinar, so I may share that out and more to come on that. But so going down the list, I think it's Colleen W. is the next person. No. If you're on mute, make sure to unmute yourself. I'm not hearing you, so we'll come back to you if that's okay. The next person on my list, Dorothy, do you want to introduce yourself? And I know that you'll be talking more later, but.
For sure, yeah, my name is Dorothy Harayama, and I'm a graduate student at Colorado State University. And later on, I'm going to be doing, just talking a little bit about a project I did with the Colorado Department of Health and Environment.
Great, thanks, Dorothy. And then next, let's see, Deanna. Can you talk? Can't hear you, Deanna, if you're talking. Well, we don't hear you if you are not connected to the audio. Maybe type into the chat box, and we can get introductions that way as well. So next is Jeannie. I think you just logged on, maybe.
Yes, I'm here. Did you want me to say something?
Yeah, so I was just hoping you could introduce yourself to the group, and then I'm just wondering if anybody's presenting at Safe States in September, and if so, if they'd be willing to present on our call in August. Well.
Oh, okay. Jeannie Beats. I work for the Department of Health and Human Services Injury Prevention Program in Nebraska. And yes, we are presenting at the Safe States annual meeting. We are going to talk about Team Driver Safety Data Dashboard. And so how we're integrating different types of data from hospital discharge, crash data, and kind of layering that with our teen driver safety work we're doing and the surveys we're doing in particular schools across the state.
Cool. Okay, well, would you be, if you're around, I may tap into you to see if you'd be willing to do a brief version of the presentation for our August call.
Yes, please do that, and I'll see what my schedule's like, and yeah, definitely.
Yeah, I think especially because we talked about data dashboards a couple months ago, so it'd be nice to continue that.
Oh, okay, yeah.
Okay, thanks, Judy. So let's see, next, I have Lisa from Larimer County.
Hi, my name is Lisa Lake. I am with the Larimer County Department of Health and Environment, and I oversee our tobacco prevention program as well as our Communities That Care grant program.
Okay. And for those of you that don't know, Larimer County is in Colorado. And then I don't know, are you going to the Safe States Alliance annual meeting?
No, I'm not.
Okay. Okay, thanks. So next, Lisa Roth.
Hi, this is Lisa Roth. I am with the University of Iowa Injury Prevention Research Center. And yes, I am going to be attending the Safe States annual meeting and presenting specifically on our partnership between an academic institution and a children's hospital.
Okay.
And just kind of some of our successes, kind of a recipe for success. But I will say, unfortunately, I have a conflict. Is it August 27th? Is that our next?
I think so, yeah.
Okay. So I have a conflict with that.
Okay. Well, that might be an interesting one to present on in the future, because I know that in the past we've talked about having more of a conversation of the role partnerships between research and practice. So.
Mm-hmm. Great. Thanks.
And then next, Mandy.
Hey everybody, it's Mandy Slegg from the North Dakota Department of Health. I focus on all unintentional injury, minus child passenger safety, and I will be attending the annual meeting but will not be presenting.
Okay, thanks for sharing. That's good to know though. Next up, Marissa Mora.
Hi, my name is Marissa Mora. I'm a graduate assistant and student at the Colorado School of Public Health. I am not attending Safe States, but my colleague, who I don't think is on the line, Sarah Brandspiegel, will be presenting an evaluation we've done with the State Health Department in Colorado over the Essentials for Childhood project, which used a collective impact approach to basically employ primary prevention strategies for child abuse.
Well, thank you. Maybe follow up with Sarah to see if she can present maybe. Let's see. Next, Pat Simmons.
Hi, this is Pat Simmons. I'm the Bureau Chief of Community Health and Wellness at the Missouri Department of Health and Senior Services, and I will not be attending Safe States.
Okay. Thanks for introducing yourself. Let's see, Sarah. Introduce yourself.
Oh, I think I'm unmuted now. Can you hear me?
Yes.
Okay, great. This is Sarah Earhart-Reed with the Office of Women's Health at Missouri Department of Health and Senior Services. And I am not planning on being at the annual meeting in September.
Okay, thanks for letting me know. Mm-hmm. Next up, Sheena.
Hi, I'm Shana Makuchi. I work on the Colorado Essentials for Childhood project, as well as the opioid overdose prevention program here at the Colorado Department of Public Health and Environment. And I will not be going to the Safe States annual meeting.
Yeah. Thanks, Shana. Next we have Tiffany.
Hi, this is Tiffany. I am with the Iowa Department of Public Health, and my role here is the Violence Prevention Coordinator. So I oversee our intimate partner and sexual violence prevention and response work, and I'm currently also the interim program director for the Iowa Violent Death Reporting System. I am hoping to be at Safe States, but I will not be presenting.
Okay, great. Well, hopefully you can attend and we can at least connect in person. Next up, is it Leisha or Leisha Peterson?
Leisha.
Leisha.
Hi, I'm with the Missouri Department of Health and Senior Services, and I work in the injury prevention program, and I will not be attending Safe States.
Okay, thanks. And then Tracy Hardy. CDC.
I'm sorry, can you hear me okay?
Yes.
Okay, I'm Tracy Hardy. I am a project officer at CDC, and I am Colorado's project officer for Core SFIP, taking over from Jamie Mills, and I will not be attending Safe States.
Thanks, Tracy. And then I think I got everybody that wrote their name there. Deanna, I don't know if you want to try again introducing yourself. For some reason you couldn't hear you before. Maybe you're on a phone line and that would work.
Can you hear me now?
Yes.
Hi, this is Deanna Farrell, actually, in Utah. I am an epidemiologist evaluator here, and I will be attending Safe States in September, but will not be presenting.
Okay. Thanks for letting me know. And then there's another phone number on here, 719-640-4828. I don't know if that's you, Deanna, or someone else.
Hi, this is Tammy Clark. I work in Colorado at the Teller County Public Health Department, and I'm a CTC facilitator, and I will not be attending.
Okay, thanks, Tammy. Okay, I think I got everybody who's on the list, but let me know if I've missed anyone. Oh, actually, there might be a couple other phone numbers. Maybe someone 303 305 9773. That might have been someone who already introduced themselves.
Can everyone hear me?
Yes.
This is Gina Ray. That was my number, and I'm a counseling intern and graduate student working at Peak to Peak Counseling in Nederland, Colorado, and we are the only counseling office in this area, and so we're working with communities that care to see how we can help with the mental health needs as they implement their prevention program. So I'm on the call.
Okay, thank you. I'm glad that you're able to join.
Thank you.
Yeah, and then one last one I'm seeing is 573-751-6340.
That's me, Alicia, with Missouri.
Okay. All right. No problem. It's just it's hard because on the participant list it shows the phone numbers and not the names, and sometimes there are duplicates. All right. So thanks everybody for introducing yourselves. It's good to hear that we've got multiple states and then also some local representation in Colorado too, which is fun. So we're going to have Dorothy is going to present on our family-friendly policy scan that we did in Colorado and give some background of what that is and the reasons for creating it. And we thought we would start off with a poll. And while I'm putting up the poll, Dorothy, I can stop sharing my screen and you can share yours to do the presentation controls.
That sounds great. Thank you so much, Colleen.
Sure.
And actually, I was going to turn it over to Shayna, because Shayna, we were working with Shayna. Shayna was the one who introduced this project to us and what they were looking for. So Shayna, if you want to take the lead on that, and then I'll jump into what we actually did.
Sure. Can everyone hear me?
Yes.
Okay. So I'm Shayna Makuchi, and I was coordinating the Colorado Essentials for Childhood project, which was an upstream primary prevention child maltreatment project. And one of our priorities or strategies for that project was family-friendly practices. And so we, as a branch, also sort of take a shared risk and protective factor approach across all the violence and injury issues that we work on. And we've prioritized economic security as a protective factor, which is really the root of that family-friendly strategy for Essentials for Childhood. And so for us, we really wanted to kind of get a landscape view of any family-friendly work that was happening around Colorado. So today we're going to be sharing this local level family-friendly policy scan report with you that Dorothy and another one of our interns worked on. This report is actually a great resource for communities that want to prioritize family-friendly strategies. And when we say family-friendly policies or strategies, we're really talking about any lever or mechanism for change that promotes safe, stable, nurturing relationships and environments for children and families. So local level levers and mechanisms can include initiatives, workplace policies, ordinances, district-wide practices, and more. And so this is really going to just show a couple of examples from that report about kind of what this is looking like in Colorado. And if folks have interest or want more information after the presentation, My email should be on one of the last slides, and you're more than welcome to email me if you have follow-up questions or thoughts that we can't get to today. Dorothy, jump in when you're ready.
All right, thank you so much, Shayna. Yeah, so I'm gonna go ahead and share my screen so y'all can see the presentation.
And then just let me know if you want me to end the poll and share the results.
Oh, okay.
We've had
yeah,
6 out of 18 people voted, so if you haven't voted yet on the poll, please do so.
Great, yes. And I think we'll get to a point where we start discussion, and so that might be a good time to look at the poll results then. And so these were, you know, the questions that we're asking in the poll, and so that's just for your reference. My name is Dorothy Harayama, and I work together on this project with Shaylin Stevens. We're both graduate students at the Colorado State University. So, you know, there's looking at prevention and injuries and violence against children more broadly, I started to think of it as both protective measures that we might have in place, such as laws stating that children must wear their seatbelt, or proactive policies and procedures, and these would try to encourage the development of healthy, thriving communities where parents and families have the support and resources that they need. And so throughout our presentation, we're going to refer to both of those as family-friendly policies. So Shaylin and I were asked by Shayna and her team to find and highlight some family-friendly policies that were happening in Colorado, so specifically at the city or county level. And this was part of a larger effort to better understand how ordinances and policies can influence these family-friendly outcomes. So we started looking at this project, and we realized that writing a detailed analysis of each Colorado city ordinance and local policy for its potential protective and proactive effects on injury prevention and violence against children was really beyond the scope of this project. So instead, we came up with a conclusion that Shaylin and I were going to be looking at projects within Colorado that were more specifically attempting to address family outcomes. And luckily, Shayna and her team, actually with the Colorado Department of Public Health and Environment, already knew of many of these kind of local Colorado projects that were happening. And so it became our job to gather more information about these projects and find out what, if any, policies, bills, ordinances, mill levies contributed to these projects. So that's kind of what we were looking at. And so you can see here our goals was to do this policy scan and then create a living document where we can add in information as we go along. So this isn't just a one-time scan, but hopefully it can be used as things change, because they will change. So Shaylin and I are psychology graduate students, so we are not well versed in the legal terms, and finding the appropriate resources was definitely a challenge for us. Just even understanding the differences in initiatives and legislature terminology. And then also we were trying to look at things we might consider unusual suspects. So as I go through my examples, some of them will seem more straightforward and some of them might seem a little bit new or unusual. Okay, this was just kind of a look at what our initial process was like of all the different people we were trying to contact for different projects. So one of the first projects I wanted to bring up was the Pueblo County Paid Parental Leave. And there are several counties within Colorado that do have some kind of paid parental leave above and beyond what state or national things require. Pueblo County, though, is not one of the most wealthy counties in Colorado, and so we were really excited to see them taking initiative on this. And so how this got started was some of the county commissioners in Pueblo went around asking their employees for things that, you know, that were big concerns for them or things that they needed, and paid parental leave were one of the big things that was brought up. So they asked one of their employees, Patsy Cresswell, to research other types of paid parental leave policies that are being used in other places in Colorado and outside of Colorado, and then come up with kind of an average of those different policies to then present to the county commissioners and then see if they would pass it for Pueblo County. And that's exactly what she did. And so she came up with some additional weeks off for paid leave. And one of the big things they wanted to really highlight was that this leave was going to be for more than just women who were pregnant or after they had their baby, but also for fathers, for parents who are adopting a child. So making it a little bit more expansive than how some other policies have been envisioned in the past. And so with full support, this was passed just recently. So now Pueblo County does have offer some additional paid parental leave for its so that was pretty cool to see. And this one, I think, can be seen, or many people might see this as being more directly family-friendly. It's providing support and resources, right, for parents. They can be more present in the early months or years of their child's life, for bonding, for not getting too stressed out from things at work. So sometimes this one might be seen as a usual suspect. Boulder County also has a lot of parental leave or bring your infant to work or breastfeeding in the workplace policy. So they're really leading the way on some of these things. One thing to note is that Boulder County does actually have a lot more financial resources than Pueblo, and so that's just something to keep in mind about how these things get enacted. But again, these are all for their county employees. Okay, sorry. So the next one I wanted to talk about was Gus the Bus. And this one I think a little bit more interesting. So Garfield County in Colorado wanted to look at how can they address long-term outcomes for people in their community. And they partnered up with the Aspen Community Foundation. And they did a needs assessment to see, okay, if we want to really improve or help address community needs, like where do we see this the most? And one of the big gaps they found was in early childhood education. And one of the other difficulties that they noticed in their community was that a lot of these families lived pretty spread out geographically. So having one geographic location for all the kids to come to for, say, a permanent physical preschool might be really challenging for a lot of the families. So they came up with this idea of having a mobile preschool education in the form of a bus. And so this was called Gus the Bus, and Gus the Bus would travel around to different families within the county, providing preschool education, but also providing access to various kinds of services. So dental services, vision and hearing screenings and services, as well as mental health screenings and things like that. And they used an example in North Carolina to base their project off of that also had a mobile school bus. So they got this up and running, and they really wanted to make sure that it was legitimate and really serving the needs of their community and that it was safe. And one of the difficulties they came across was that there was no license that was appropriate for a mobile preschool education. There was licenses for preschool education, and there were licenses for mobile, I think it was like elementary education. But this didn't really fit the needs of what they had. So for example, for a permanent location, the license requirements were like, you need to have a certain amount of play space outside that's in an enclosed area, and the fence needs to be a certain height, and all these kinds of things that wasn't really feasible for their kind of project. So they worked with someone in with a state for a new type of license, and particularly this was Karen Rosa, and so together they formed a new type of license for mobile preschool education. And then now they, so it just makes it a little bit more formal. It means that there's actually some oversight, and it also provides more trust with the community, that they really want to make sure that this is the highest quality product. So again, you can kind of see this operating on many different levels. One is that you're bringing preschool education to families that might have a difficult time getting there. They are offering a lot of other types of services that might also, again, be difficult to get to. They engage parents in volunteer work and things like that. So, and providing education about how best to help young kiddos. So there's a lot of things going on here that we can see might have long-term family-friendly outcomes, as well as short-term. Okay, so the next one I want to talk about is definitely getting a little bit more into the unusual suspects. And this was in Avon City in Eagle County, Colorado. And so there are currently rules and laws about wearing seatbelts. However, in Colorado, it's a secondary offense, which means that police officers would need to pull over someone first for something else. And then if they see that everyone's not buckled up, they could then also cite not wearing a seatbelt as a problem and have a fine or whatever, whatever those repercussions are. However, there's a lot of concern that there's still not enough use of seatbelts, and as we know that this can have, that this can drastically reduce the effects of or the likelihood of having severe injury and death in the event of car crashes. And there's some research to suggest that having a primary seatbelt ordinance, which means the officer can, if they see someone without a seatbelt, can pull someone over and they don't need another reason, that those types of primary offense laws really can reduce the likelihood of people not wearing seatbelts. So this seemed like, something that might be helpful. So the chief of the police at that time in Avon worked really hard to gather support, and in particular from the Latino community. And I think this was really crucial as, there was some concerns that adding another reason for police officers to pull folks over is that you might see, increases in racial profiling or, issues of this kind. And so I think it's really notable to say that the police officer the chief of police worked really hard on engaging various community members and gathering support and providing education about what the seatbelt ordinance would be about and the importance of wearing seatbelts. So that was pretty great to see. Another type of ordinance that was passed here in Colorado was started by a Girl Scout troop. And so this Girl Scout troop had invited a local politician to one of their meetings to talk about kind of the legislative process. And after this meeting, they had gotten really interested in, what kind of, is there something that we could do to further help our community? And they were particularly concerned about smoking in cars, particularly smoking in cars with minors, which could have a lot of detrimental health effects. So they worked with, they had some advisors, some legal advisors, and they wrote up a draft of like a primary offense ordinance for their city to talk about, so again, primary offense, allow a police officer to pull over a car if they see people smoking in that car with a minor. They did get some initial pushback, both from kind of the right side and the left side of the political spectrum within their community. There was concerns that, again, kind of racial profiling or this would detrimentally or more detrimentally affect people of lower socioeconomic status because there was the initial ordinance had a fee associated with it or a fine, and there wasn't any other options if you did get pulled over. In addition, there was some concerns about, civil liberties and things like that. So there was some initial pushback from both sides. And so the Girl Scout troop went back and revised it. And so they then recommended that it would be a secondary offense. So this would mean that the police officer or any police officer would have to there would have to be another reason that someone would get pulled over. But then if someone is pulled over and they're finding that they're smoking going down in a car with a minor, they could then also address this issue. And recognizing the fact that paying a large fee is not always the most helpful for people who are already struggling financially, they also put in something in this ordinance in which if you're cited for this, you can do community service instead of paying this fee. So that was their way of attempting to address this concern that their various community members said was present. So I realized that I might have been talking a little bit fast there. So we're going to get into the discussion here pretty soon. And feel free to ask any questions you have about what I was talking about, or we can jump kind of more into your experiences with family-friendly projects and things of that nature. First off,
I did just share the results, yeah, in case you want to reference those.
Yeah. I'm just gonna, can everybody see the poll results, or is it just me?
I think everybody hopefully should be able to see.
I can see them.
I can see them too.
Okay, great. Yeah, so here you can see, looks like almost everybody has already heard of family-friendly policies, which is awesome. Many people feel like they benefit from family-friendly policies. And it seems, and some people have already been involved in trying to create or change local bill policy or ordinance. I'm curious if any of the ones that people have tried to change, if you think they had family-friendly implications. And yes, and then the last one, I will be able to look at your answers at a later point in time.
I don't think anybody typed in the chat box, but if people did, those who did say yes to that question number 3, if you wanted to share a little bit about your process for getting bill, policy, or ordinance passed, I'm sure we'd be interested in hearing.
That'd be great. That's a great idea.
And you can speak up if you're willing to share.
Yeah. Just in case anyone missed what Colleen said, if you answered yes to being involved in changing a bill, policy, or ordinance, we're just curious if you would mind sharing what was your process like, what was the bill, policy, ordinance, and what happened afterwards. I'll give it a minute. Okay, you can always jump back in later. So my first question that I'm kind of wondering is, after hearing today's presentation, I'm wondering if your conception of family-friendly policies has changed at all, and if so, how? Or maybe it's been pretty in line with what you already saw.
Hey, this is Jeannie Beats, and I guess you broadened my understanding of what a family-friendly policy could be. I was always thinking in terms of maternity leave, paid leave, that kind of thing. And so I like the idea of, the smoking ordinance or the seatbelt ordinance. I think those were neat ways to get, those kinds of policies in place. So you brought in my perspective of what that could actually include.
Great, thank you so much for sharing.
Yeah, this is Colleen. I agree with Jeannie on that. I think it's also a good reminder that by expanding that view of family-friendly policies, we have a potential to impact outcomes beyond injury and violence. So I think the tobacco one is a good example where have the ability to impact smoking rates or something like that. And I think it's a good reminder that as we move upstream or think about policy change, we may be able to think of new and different partners in the work that we do, especially working with tobacco partners or chronic disease prevention.
Well, yeah, thank you, Colleen. Yeah, that's exciting to hear. It will be helpful. Any other comments about that?
This is Shayna. I think that one example that we didn't share today that I would chime in with now is one of those sort of district-wide practices that we found in Colorado that I thought was really unique. And it's a school district that updated and changed some of their curriculum so that it was accessible to all of their students. It wasn't just an elective. It was something that all students got, and it was their comprehensive sex education, which really also talked about things like consent, and also, some of the pieces that are common in those types of curriculums, like safe sex, and also some of the disease-related things that are often brought up, STI, STD type of conversation. And so I think for them to be able to provide it to all students really gives folks an opportunity to start thinking about healthy relationships and ways to have consenting conversations, which I think can impact violence and injury issues as well. And that was a really cool initiative on a district level that we learned about, and I think that that has really potentially positive outcomes for families. And so, yeah, I'm kind of curious specifically with that example to see if there will be data down the road that shows some positive outcomes for families or for reducing risk of sexual violence issues or things of that nature. So, you know, I think exactly what Colleen was saying is that, you know, this process has really made me think a lot more broadly about family friendly, being able to touch a lot of different issues, some within violence and injury prevention and some sort of outside of that. And for folks that are interested in more of the workplace kind of practices and policies, our Colorado Essentials for Childhood team did really work hard on a tool. It's the Family Friendly Workplace Toolkit that has examples of how employers are working on becoming more family friendly and some of the different kinds of policies and practices that are possible. So if folks are interested in looking at that as a resource, we're happy to share that out as well.
Shana, would it be okay if I shared out both the toolkit and the scan with the group after the call?
Yes, absolutely.
Okay.
Fabulous. Yeah, thanks, Shana. Did anybody have any comments about that before we move on to our next discussion question? So I am curious, for the people who've been involved in some kind of project, initiative, policy change, ordinance, bill, things like that, what kind of projects have you been involved in? There's so many to choose from. Okay, well, we can come back to that one if people do have anything they'd like to share. I'm also curious for people who haven't already been involved in such a project, what avenues do you think you have access to get involved in that kind of work?
Well, I know that a lot of the people on the phone today work at the state agency level. So a lot of us represent injury and violence prevention programs at state health departments. And so I think that our role often in policy change is around educating decision makers and providing data to help inform their decisions, and usually can't be so upfront with the legislative process at the state level, but instead are more educating on evidence-based practices and best practice. So I know that we've talked a lot about that in this group in terms of what our roles have been. And then some of us have also had the opportunity to testify in front of state legislatures when requested by those legislators.
Yeah.
This is Mandy from North Dakota. I would say that like our biggest asset, just because as Colleen mentioned, you know, I work for the Department of Health, so we're not always able to testify on everything or advocate. So our biggest asset, I would say, is like the partners and the outside people that we partner with. So just to keep them informed and hope that they help move policy forward.
Nice. Yeah. So it sounds like, right, it might feel like at times that there's limited options for directly affecting policies, and you have the chance to work a lot with partners who might be able to. And I'm wondering if anybody has either a project or a story they might want to share about something in their state or their community that's happening with one of their partners. I'm curious what kinds of other projects are out there and how they happen.
So this is Shayna again. I can talk a little bit about some of the ways we've been able to leverage opportunities with partners internally and externally to be able to do some of this work. We have been very intentional with our Communities That Care project to include some of these like family-friendly strategies as one of the options in the menu of strategies for communities to choose from. So if communities want to work on family-friendly practices and policies in their community, it is one of the options that they can prioritize. And I know I did hear some folks are CTC folks on the line, and maybe that's a way to engage in this work if it's not already happening and there's interest. Is just to expand sort of the menu of strategies that folks can choose from. Other partners that we've worked a lot with is our child fatality prevention system. Some of the local teams are really invested, obviously, in healthy outcomes for children and families. And so the legislative report really has that they put out every year has really looked at some of these family-friendly policies to see which ones they can find a good amount of education to back it. And that goes to legislators to review as a way to provide some education around why that might be like an important topic to think about when it comes time for legislative season to roll around. And then one other example I can talk a little about is in our health department, we try to collaborate in whatever ways seem possible with some of our other branches. And so through some of our family-friendly work, we've really been able to partner with our maternal and child health partners. Those partners in particular have a strategy that's around infant mortality and wanting to reduce those rates. And we've been able to leverage some funding through that work in the interest of parents and babies and children being healthy and well and decreasing family stress. And so on the local level, or on the state level, our MCH folks have been able to fund local MCH folks at like 0.2% or point something percent of their role to include some family-friendly work. And some of those folks that are actually in those positions, part of their roles might be screening or some of the other MCH strategies and priorities, but they still get to use a portion of their time to work on family-friendly practices and policies. And so they have the opportunity to do some internal work with their health department, or they can work on a community project, depending on sort of what the needs are in that community and where there is some buy-in to have this conversation. And so those are some examples or ways to think about where this could fit or what this could look like, whether it's staff time or leveraging funding or just prioritizing this as an option for folks to choose from when they're strategizing. Those are all some ways that we think about how we can promote and move some of this work forward.
As Shayna mentioned, I know that there are some Communities That Care representatives on or facilitators on the call. I was curious if you've thought about applying or using this type of policy scan for the work that you do in your communities.
Hi, this is Lisa from Larimer County in Colorado. We actually have not picked our strategies yet, so we can't say for sure what we will be working on, but it's definitely something that we always think about in any type of policy work that we work on. So.
Thank you.
Is that on my end? Yes.
Okay,
There
thanks.
we go. All right. Thank you for joining in there. Sorry I got cut off by a phone call. Anybody else who wanted to talk about whether or not they see themselves using this kind of policy scan?
This is Jeannie Beats again. I guess it's, for us, it's maybe a different way to look at, like, I know I want to get some things changed in our state around graduated driver's licensing, and that is definitely, I mean, I never looked at it as a family issue as far as family friendly, but it is. I mean, because our laws are not very strict, they're secondary enforcement, and parents really, they're wanting this information. It's hard to find the information about the driving restrictions. And so we're not being very family friendly as far as guiding them in what the restrictions are and why the restrictions are there and how it does benefit them as a family to know these rules and to enforce the rules, which leads to safer teen drivers, kids not being killed on the roadways. And so, it kind of is giving me a food for thought in how to address maybe some of these traffic safety issues. That's primarily that was what I work on. And so it kind of gives me a different maybe perspective instead of always looking at it as a negative, because everybody thinks laws, you know, when you're trying to institute a law, it's just always a bad thing, and no, it's not always necessarily a bad thing. And so kind of framing the kind of your message around being family friendly in regards to that particular issue may be able to get us a little further ahead too.
Sure. Yeah, that was a really great specific example. Thanks for sharing. It's interesting for me to hear about, for sure.
And Dorothy, can you just expand on sort of that ordinance really came about because another community outside of Colorado, I believe, had already done this, and so they had an example to build on. Am I understanding that correctly?
Yeah, I was going to talk about that a little bit more later, and I'm happy to dive in right now. Yeah, one of the things, especially for the Girl Scout troop, the reason why they eventually were successful and to show that this was a feasible option was they looked to find what other kinds of, or what other cities have done and how they've approached this issue. And so they did actually find a seatbelt ordinance a smoking ordinance like the one they ended up suggesting in Hawaii. And so this was one of their major pieces of support, and that helped get other people on board, was showing that it's being done in other places and it might have these kinds of results. So that's often a very helpful place to start. Was that what you meant, Shayna?
Yeah, exactly. Just thinking that a lot of the like local level work that we learned about really just mostly folks built off of finding an example and building their idea out further, or having a community champion who I guess I would say, for lack of a better word, really had enough power to move things around, which I think was the case with the seatbelt ordinance. Right, Dorothy? That was
Yeah, exactly. So I'll go ahead and show, these were some of the major themes that we found across a lot of the projects that we looked at. And so, Shannon, exactly like you're saying, many of these projects really drew upon other examples, and not necessarily from within their state, but kind of operating on a similar level. So if they want to pass an ordinance, also something at that ordinance level. And then that's part of doing a lot of the homework as we thought of it, where you're really looking into what are the options, what else is being done, who might be the key people that needs to be involved. Many of these projects we see people at all kinds of different levels involved. So community members or people in the school district, people in foundations, people in working in politics, county commissioners, things like that. And then of course what seems to be common element is that they all really cared about improving their community, and that includes these family-friendly outcomes. And I'm curious if anybody else has something to add where they think there's another piece that's needed to make these projects successful, either in their experience or listening to these examples. Okay, well, I think we're coming close to the end of our, or my part of the presentation for today. So in addition, I just want to chat a little bit about how this information is then going to be used. So I only talked about 4 projects, but I think in total we ended up highlighting about 8 in our current report. And again, we hope this project will be dynamic, so something that people can add to, expand, or change as needed as things go along. And we also really want to highlight the fact that these are just a few of the many projects that are probably taking place in Colorado. And this was an initial step to start looking at what are those projects, how do they get started, right, and what kinds of things help them be successful. Shana, I'm not sure if you want to talk more about that, about the final report.
Sure. So as of right now, we recently shared this report out with numerous partners, as well as all of the folks that took place in sharing their stories and connecting us to the right people to really share this out that way. And then we've also shared it out internally with our branch to share with all the programs partners. So CFPS mentioned being able to share it on their blog. That's our child fatality prevention system. And that goes out to all of their local teams. We've shared it with MCH partners who are doing work to be able to do more family-friendly work on a local level. And then as well with like our CTC coaches to send out to their teams. So we've really been able to send it out just briefly to folks, and then we're working on sort of a larger, almost like dissemination plan, where we hope to have this live online and have a way for folks to submit information from their communities and their projects. And eventually we hope to also have sort of a visual, clickable type of piece to this, where folks can really just click around Colorado and be able to look at this in a more visual way as well. So we are definitely working to build some of that out.
Great. Colleen, I think that's it for my portion of it. I know you might have had a few comments for everyone on the call.
Yeah, thank you so much, Dorothy, and thank you, Shana, for presenting on that. Like I said, I'll be happy to share out the report with the attendees. And if you have additional questions, Shana's contact information is on the screen. So if you wouldn't mind, I'm going to share my screen again. I think I can go ahead and just do that. So just a few things to wrap up our call today. I wanted to announce that some congratulations. We have 3 out of the 4 Innovative Initiative finalists for the Safe States Alliance and Innovative Initiative Award be from states in our regions, 7 and 8. So I thought that was pretty cool. And that includes Kansas, Utah, and Colorado. So if you are a Safe States member, I encourage you to vote for the finalists, and hopefully one of us from our states will win that award. And I will also send out the link for voting in case you haven't received it. But I thought that was pretty cool to notice that that states in our region are doing some pretty cool work and innovative work. And then I wanted to let you all know that we'll have our annual in-person meeting at the Safe States Alliance annual meeting. And I know not everybody can attend in person, but I did want to check to see if you can't attend, if you would be interested in setting up Zoom so that we can attend remotely, or to see if you can attend remotely. So if the poll is up on the screen, hopefully you can take it, and that would be just helpful for me to know before and to see if we need to get internet access or anything like that. And I'll also make sure that I send out this poll to the larger listserv, because I know not everybody could attend today. And then, so I'll leave that up as I finish wrapping up, but our next call is going to be Monday, August 27th, 2 to 3 p.m. Mountain Standard Time and 3 to 4 Central Time. And as I mentioned earlier, I thought it would be a good opportunity to hear some of the Safe States Alliance annual meeting presentations from those of us who are presenting, maybe a briefer version, and it will just provide the opportunity for those of us who either can't attend the meeting in person or might be competing with other concurrent sessions. It'd be a good opportunity just to hear more about what is happening across our regions and the great work that we do. So I think that is it for our call, our learning opportunity today. Again, thank you to Dorothy and Shana for preparing the presentation and sharing with us about the family-friendly policy scan. And then Shana also just put her email in the chat box again. And so if you have any questions regarding the SCAN project or anything else related to family-friendly work that we're doing in Colorado, feel free to reach out to Shana directly. And I think with that, if anybody else has any last things or questions to say, otherwise I think that we are all set with our call today. Okay. Thank you very much.
Thanks, Colleen.
Yeah, thanks, Dorothy.
Thank you.
Bye.